dizziness, chills, sweating excessively, rashes also known as urticaria, taste of metal in the mouth, nausea and vomiting, sneezing, cough and a sensation of heat. After injection of contrast media, if a patient presents any of these signs or symptoms, the most advised set of responses is to reassure the patient that the symptoms are due to a minor reaction and would usually stop in less than an hour, make a bowl available in case the patient needs to vomit, promote ventilation by loosening all tight clothing, and encouraging the patient to take deep breaths. Also, monitor all the signs and symptoms and ensure that they diminish before letting the patient go. If the signs and symptoms do not clear up after a while, call for the help of a physician. The next set of reactions based on severity are the moderate reactions. Signs and symptoms under the moderate reactions include an increased heart rate, known as tachycardia, a decreased heart rate, known as bradycardia, hypertension, hypotension, shortness of breath, known as dyspnea, wheezing due to a bronchospasm, pulmonary edema, and laryngeal edema. Unlike in the mild reactions, this set of reactions usually requires medical attention. However, the signs and symptoms do not yet indicate a life-threatening situation. The goal in this type of reaction is to prevent its progression into a more fatal reaction. The usual response is to send for help when these signs are observed and to treat and monitor the various symptoms. For example, if the patient is experiencing shortness of breath, his head and shoulders are elevated to encourage proper respiratory function. The next type of reactions are the severe reactions. Signs and symptoms that indicate a severe contrast media reaction include further cardiac arrhythmia, cardiopulmonary arrest, or unresponsiveness of the patient. In this type of reaction, the signs and symptoms indicate a life-threatening situation and immediate treatment is required. In fact, many patients that experience this need hospitalization. The best response in this situation is to send for help, and because many of these patients are unable to breathe, artificial respiration is often administered. Thankfully, with the use of low-osmolar contrast media, the great majority of reactions that occur are mild. However, there are certain groups of patients that are more likely to progress into a severe contrast media reaction. We will conclude this video by highlighting some of these high-risk groups. They include infants, elderly patients, diabetics, patients with cardiac impairment, patients with renal impairment, patients suffering from asthma, patients who have experienced previous contrast media reactions, and patients with a wide history of allergies.